I'm really glad to be here, even if it meant just getting yanked out of my office yesterday. Vinny asked me to do it, I'm here. It's wonderful to hear that kind of optimism about our public policy. You don't get it very much turning on the TV or reading the newspaper, but it's there. We have to sustain it. And I want to, first of all, salute Vinny and all of you who are marching, especially these marchers. 10 years ago, I walked from Selma to Montgomery to reenact that march. It took a week. We had walking seminars. And I can tell you that having studied the Civil Rights Movement and the Voting Rights Act and the Voting Rights March for 25 years, there's nothing like marching 50 miles talking about it to bring to the fore to you what it really means in everyday lives. So I want to salute these marchers. Healthcare is personal. We need to talk about it more personally. It's our feet, it's our breasts, it's our prostates. Don't be ashamed of it. It's our very essence, our living selves. And I want to make 3 comments about that, opening up here to encourage you to speak about health care more personally. First of all, on a very personal note myself, I had atrial fibrillation in my heart, which threatened to end my life until I had an ablation procedure in November. When these amazing little computers went up through the veins and sealed off the places in my heart that were sending out the abnormal electrical system. Now I am basically cured right here in Maryland. Never let the opponents of healthcare reform drive a wedge between us and our doctors. Our doctors work miracles. Our system can do miracles, but they're fighting a totally improperly organized healthcare system. Make doctors our allies. That is one of the most positive changes since 1994, the last time we tried to have comprehensive health insurance, and the majority of the doctors were against it. Let's take advantage of that. So, speaking personally, we have a wonderful system in some respects. It's just crippled in many others. Also, speaking personally about this church, think of unique ways of doing things. This church, half of you probably don't know, but in this church, right now at eye level at the urinals, they post the week's scripture lessons. If you abide in me, you will bear much fruit and become my disciple. John 15, you can study that. So we need to remember that we always need to come up with new things, new approaches to keep out there marching. Also, being in this church, an Episcopalian church in a wonderful neighborhood of Baltimore, I want to talk to you about money. And I normally wouldn't do this, but because I finished a book about President Clinton a couple of years after finishing Martin Luther King, and now HBO, I hope, is trying to make a mini-series based on the civil rights books. By some oddity, last year, we will pay more in taxes than we ever earned in our lives before. And to those of you who make above $100,000 or above $200,000, I want to commend one thing to you. Be proud of the fact that we're paying those taxes. Talk about them. You don't have to say, I love the taxes, but you can say, I want to discuss the balance of public and private needs in the United States. Because half of our population is suffering under private needs and private needs that need to be met. But the other half of the population does not need to eat more, wear better, drive a bigger car, live in a bigger house. Our public needs, our infrastructure, the public needs all over are our most pressing need. And don't be ashamed of that. Never be ashamed to debate the balance of public and private needs in the United States. We've gotten poisoned now in the anti-tax mood, where basically people say there is no public agenda that is more important than another dollar of marginal income for me. That's wrong, and we are suffering almost fatal cynicism in the public place for those people who don't listen to Vinnie DeMarco. Now, when Dr. King...
Like my sons.
Dr. King approached this issue in a totally different era. In 1966, he went to a conference at the White House called To Fulfill These Rights, and it was about how to make real the promises of the Civil Rights Act of 1964 and the Voting Rights Act of 1965. It was already paralyzed by a lot of internal contradictions, largely growing out of the Vietnam War, and personified for me by a kind of healthcare crisis. PFC Jimmy Williams, a Green Beret paratrooper, was killed in Vietnam the very week of that conference in June 1966. He was shipped home to be buried with honors in Alabama, but the mayor of his town said he can't be buried in the white cemetery. This is only 40 years ago. Nowhere in Alabama could a Green Beret soldier killed in Vietnam be buried in a white cemetery in the state of Alabama 40 years ago. And because it was too embarrassing, 2 years after the Civil Rights Act theoretically outlawed this, to bury him in a black cemetery in Alabama also, the authorities mumbled and hid and kept him on ice until finally they had to bury him at the Confederate Cemetery in Andersonville in Georgia, over in a different state. This is where we were 40 years ago. Medicare was brand new. Since then, we have mediated all of the competing demands for health care, our most precious thing that we have, our bodies themselves, life itself. Somehow we have mediated all that through insurance companies. So that, ironically, now we say that the mark of being a substandard citizen, almost like the mark of having to be buried in Andersonville or not being able to vote, is that you are uninsured. There are times when people need a victory. It may not be the whole victory. It may only be a partial victory, but when you're struggling and you're trying to do the impossible, there are times you need to take a step forward and have a victory. And they did. And they took this thing, and it was controversial. And then the white folks in Birmingham bombed Birmingham anyway, and it spilled nationally into what became the Civil Rights Act, and it went forward. The point here is, don't get too upset about this health care bill is not going to be the end-all answer, no matter which version it is. Don't get too caught up in whether or not we're not going forward all the way now. Just make sure that we get something now, because I think, like in Birmingham, the people need a victory. They need to step forward. Whatever we get, let's get something. Let's keep marching. I just want to tell you one. Remember what a service you're doing just by being here and saying healthcare is on the optimistic side of life, that we can begin to restore the balance of our public life, our optimism, and subdue this cynicism that exists out in the public square. You are part of it. Spread it around, share the grace, share the beauty of having the health just to be here in this room together. Thank you.